taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenore and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. Welcome to the Wellness Watch. I'm your moderator, George Strait. Asthma, that all too often wheezing, coughing, breathless, sometimes debilitating condition that affects 1 in 10 African Americans and kills us at a rate 3 times higher than whites. So what is it, and what can we do about it? What can we do to prevent it? Well, we've got the very perfect examples and experts for those answers. The host of the Wellness Watch, Dr. Mike Lenore, who's also an expert in asthma and allergies, and Dr. Jamila Martin, a practicing physician with Sutter Health, who specializes in treating asthma and related diseases. Drs. Martin and Lenore, welcome.
Thank you.
Dr. Lenore, without getting too technical, what is asthma and how does anybody know that you have it?
Well, asthma is more a wastebasket term. That means a chronic inflammatory disease of the lung. That means that a bunch of cells move in the lung. Sometimes to protect you, set up shop and release these chemicals which force the airway to close down. As it closes down, people start to cough. As it closes more, people start to wheeze and show signs of obvious respiratory distress.
And Dr. Martin, what can one do about it? I mean, let's talk about medications first.
Well, thankfully, we live in a time when there's a lot we can do to treat this condition. There are inhalers. There are quick-acting inhalers for sudden symptoms. There are what we term controller inhalers or more preventive inhalers that are taken more on a day-to-day basis for patients who have symptoms that are more persistent. There are oral medications, a variety of different categories. And then there are also newer medications that are injectables that can be injected in clinic or injected at home. So we have a pretty wide armamentarium. There's a lot that we can do for this condition these days.
So it seems to me that if one sort of understands their disease, that there's a lot there that can help, that can relieve some of the anxiety and the physical stress, right?
Absolutely. I tell all of my patients there's no reason that you should be suffering with asthma. There should be no limitation on your activities or what you can do. It's my job to make it to where you can participate fully in life.
Dr. Lenore, is asthma more prevalent in children than adults? And frankly, what's a mom to do when her child wakes up in the middle of the night wheezing and out of breath?
Yes, I think asthma is more prevalent in children because there are different types of asthma that children have. Small infants can have something called reactive airway disease. They wheeze when they wheeze, usually stimulated by infection, and in between episodes, they don't benefit from any treatment. They usually outgrow that by the time they're 4 or 5. Then there's the allergic type of asthma that children have based upon certain triggers. Probably the 6 most common triggers for asthma in children have to do with pollution, obesity, allergy, and smoking. So there's several different, they don't smoke, but they're around smoke. And so there's several different triggers that can trigger the problem. But what we see most often in children is more an allergic type asthma, which is triggered not only by allergens, but also by infection.
Dr. Martin, Dr. Lenore mentioned something that I'm quite familiar with, and that is sort of growing out of asthma, if you will. When I was a child, I think I had asthma up until about the 6th grade, and then all of a sudden I didn't have it anymore. Is that typical for kids, and how does all that happen?
I would say that's not necessarily typical that you're going to outgrow it. It's rare, at least in my patient population, that I see patients who had asthma as a child and it never came back. I tend to see more the scenario of people who had asthma as a child. It may have gone away for several years. I often see it become dormant or become quiet into high school, into the college years, the early 20s. And then it sometimes can show up later. Sometimes it can show up in pregnancy. It can show up later in life. So I wouldn't say that outgrowing it is typical, but it definitely can happen. And it is fairly typical that it can get a lot better or have extended periods of inactivity.
And just to follow up on one other thing, suppose what you really have is the flu or seasonal allergies, and not asthma. How is a parent to know the difference between that and asthma? And also, what about asthma that's caused by exercise, Dr. Martin?
Mm-hmm. So there are some overlapping symptoms between like a cold or the flu and allergies, but there are a couple important clues there. So yes, both will give you nasal symptoms, congestion, postnasal drip, runny nose. But with the flu, that's going to be more of an infection, typically viral. You're more likely to have fever, other symptoms like body aches. You may have a decreased appetite. You can even have nausea or vomiting. So there are other symptoms there that can clue you in that this is an illness as opposed to allergies. Also, with an infection, those symptoms tend to resolve within 2 weeks at the latest. I mean, a typical cold is generally 7 to 10 days, whereas with allergies, particularly in the pollen season, your symptoms will tend to be persistent, will last more than 2 weeks, can be intermittent, but overall kind of persist, sometimes weeks at a time. You're not going to see fever with seasonal allergies. You're going to have a normal appetite. And there's going to be more of an element of itching of the ears, of the nose, of the eyes, of the throat, of the hard palate of your mouth, and usually a little bit more element of sneezing as well. So those are clues that can be helpful to kind of sort things out. And then in terms of asthma with exercise, I think we're going to get into this a little bit later with triggers, but exercise is an important trigger for asthma. And when you're exercising, it's not like when you're running, like everyone feels a little short of breath when you're running, but when asthma kicks in when you're exercising, you feel constricted. You feel a sense of chest tightness. A lot of my patients, particularly my pediatric patients, will tell me my throat feels like it's burning. It may trigger wheezing, so that when you're running, when you're breathing, you have sort of more of a whistling type sound, particularly when you're breathing out. And asthma triggered by exercise will cause you to have to stop exercising. And so that's kind of the difference between I'm running and I'm just a little out of shape, and I'm running and my chest is constricted, I have tightness, I'm wheezing, and I really acutely need to stop exercising.
I think when it comes to exercise, I've got another trigger that forces me to stop it, but it has nothing to do with asthma. We were talking about triggers, and we're talking about action plans. Dr. Lenore, I guess prevention really has got to be part of any plan to mitigate asthma. Let's talk about some of those common triggers and action plans and ways to guard against them.
Well, I think one of the biggest problems that we see when you have any chronic disease is adherence to the treatment program. Most people tend, certainly in my culture, tend to think of asthma as an episodic problem, when really asthma is a chronic problem and requires a chronic approach to managing it. So the medicines that we prescribe, let's say the triggers that we identify and ask them to avoid, the medicines that we prescribe need to be taken on a regular basis until we see some improvement and gradually reduced in an orderly fashion. So that's one of the issues that we see with asthma. I would like to make a comment about exercise too. So often we see patients who say, well, I have exercise-induced asthma. But what they really have is chronic asthma manifested by exercise. And so consequently, they need to be treated not just episodically, but often very chronically. But the big problem, Mr. Strait, is the adherence to the treatment programs that we set up for patients. I think the doctor was correct when she said that, Dr. Martin, when she said that her patients don't really have as much difficulty. I very rarely have a patient that's admitted to the hospital because there are certain things that I try to do to make sure that they adhere to the things that we ask them to do and to orderly reduce the need for medication. Mostly, and Dr. Martin may not approve of this, I am the only one that can write prescriptions for albuterol. That gives me absolute understanding what the control levels are. And if they run out too quickly or they keep it too long, I know exactly what's happening. And so in my office, I am the master G of the albuterol. That helps me to understand the nature of what patients are doing.
So is there some controversy around albuterol?
No, there's no controversy around it, except it is the one drug that asthmatics always want, that children with asthma or adults with asthma will have around. They're not going anywhere without that albuterol because they know it can be an immediate intervention in a life-saving problem. So that if I'm in control of the albuterol, you can be at your grandmother's house, but if you missed your appointments, at least a number of your appointments, then you can go to the emergency room. But I'm not going to refill it just simply because you're in trouble. I'm going to make sure you have some out, but mostly that you go to the emergency room. So if I'm in control of the albuterol, that's the one drug most patients with asthma will always try to keep around.
So let's break it down for folks. We've got a lot of really an awful lot of good information on what causes asthma, what it really is, what it isn't, and ways to mitigate and action plans. Let's break it down for folks. What are some of the do's and don'ts when it comes to asthma? We'll start with Dr. Martin, then go to Dr. Lenore.
Well, I think some of the do's are seek care from an asthma specialist and an allergy immunology specialist who specializes in the management of asthma. I think our primary care colleagues do an excellent job of identifying patients that may have asthma and getting them started on treatment. I think that it's important, if possible, that they connect with a specialist that can take it to the next level and really have that be their primary focus so that we can optimize control of their asthma. I think another do is to be knowledgeable in your disease. I think listening to sessions like this is the first step. And I think, doing research, reading, educating yourself on the disease and what triggers you. You'd be surprised how many times I meet a patient and I say, okay, you're 40 something years old, you've had asthma since you were a kid. What triggers your asthma? And they sort of look at me dumbfounded sometimes. So it's important to know what triggers your disease. It's also important to know, how do you avoid those triggers? How do you manage those triggers to be proactive, to take a lead in managing your condition, and then also know what medications you're supposed to be taking. It's also surprising to me when I meet patients that this is not their first rodeo, but you ask them, what is your controller inhaler, or what inhalers do you take? And they struggle to come up with a name, sometimes can't even tell me the color of the canister. And this is for patients, to Dr. Lenore's point, who are supposed to be on a daily controller inhaler and that they clearly aren't taking. So I think it's really do take ownership of your condition and be proactive and be anticipatory. And I tell my patients, by working together, my goal is to make you savvy. My goal is to have you understand your condition more than, say, a random urgent care doctor who might be seeing you, or at a walk-in clinic. No one's going to know your asthma better than you do. So I would say those are definitely some do's. And I would say, be an advocate. If you're the one with asthma, advocate for yourself. If you are the parent of a child with asthma, or the spouse of someone with asthma, or the best friend, help advocate for them. Help them be truthful about the symptoms that they're having, how frequently they're having those symptoms. Help them be truthful about, are they adhering to their management program? And if, be advocate in terms of getting across to clinicians or providers who may be seeing them exactly what's going on. I've had personal experiences with family members getting a call. My niece was in the hospital and the ER was trying to send her home. And I knew that wasn't the right thing to do. And so my family members did the right thing and called me, and I got on the phone with the attending and we got it taken care of. So definitely do advocate for yourself.
And Dr. Lenore?
Oh, well, I think one of the things, don't miss appointments. I mean, if we treat asthma as a chronic disease, I think that's one of the bigger problems. When you're not wheezing doesn't mean that you don't have problems. I think the studies have suggested that you need almost 60 to 70% airway obstruction before you actually can appreciate wheezing. So you can have a lot of asthma without that kind of dramatic respiratory distress that characterizes serious attacks. So I said, don't miss appointments. Try to make your appointments on a regular basis. There are certain things that you can do at home, and there are certain things that you can do in the office to help you assess the quality of the patient's respiratory issues. Certainly, things that we call spirometry, where they can breathe into a machine and we can see how much air they move over time. And there are certain things at home, paper tests, occasionally peak flow meters, things that give you relative measures of how you're feeling against what your lungs are telling you. So I think when we're treating it as a chronic disease, not treating, I'm sorry, not treating it as a chronic disease is one of the big don'ts.
And controlling our environment is a difficult thing because it's not something that you can control in and of yourself. But I would guess that trying to get some control around your environment is important here as well, right?
Well, yes, I think that's really critical. I think there are a couple of things when we talk about the big triggers. We talked about allergy. We talked about obesity. We haven't said much about that. But children who are and adults who are obese have much more difficulty. Obesity is a chronic inflammatory state. Allergy is a chronic inflammatory state. And there's some evidence that there's a connection between the two. But I also think that obese patients with obesity need different levels of medication, are in the emergency room more. And so that's something that you can do. In addition to avoiding your triggers, you can watch what you eat and certainly reduce obesity. And then you can stop everybody in your environment from smoking. When your parents smoke outside, that's not helping you. I mean, people who are exposed to secondhand smoke can be just as sick as people who who are exposed to primary smoking in the environment. So I would say that the elimination of those triggers things that you can do. You can't do much about air pollution. You can't do much about some of the things, but certainly about allergy, about obesity, about smoking. You get to be proactive in those environmental states to reduce exposure and exacerbations from asthma.
And Dr. Martin, do you have anything to add there?
Yes, I would say, speaking in terms of personal responsibility in regard to smoking, let not you be the smoker. And that includes vaping, and that includes inhaling, legalized marijuana if possible. That's a very modifiable risk factor for asthma. And then I would also say, try not to ignore symptoms. I'm surprised how often I see patients that come into me with really severe asthma exacerbation that was caused by a cold, and we know cold is a trigger for them, and they say, well, I said, what have you been doing? And they say, I've been, drinking warm honey and lemon water, and I took Robitussin, and I say, well, what about your controller inhaler? And it's like, oh, they say, I thought I just had a cold. So I would say not to ignore symptoms and really be on top of what your triggers are.
So one final question for both of you. How important is it, do you think, to find an allergy specialist that actually looks like us?
Well, I go back to a study that I've believed a long time. There was a study that was done and reported a couple of weeks ago that in areas where you have Black doctors, people die less often. And I would say that understanding culture, understanding, trends, understanding folkways and more ways has a lot to do with dealing with any chronic disease. So as an African-American allergist, obviously, I think I have the advantage. I would also say that so often those of us who practice in urban inner cities, we take care of the sickest group of people in the system. And so I think that experience of having to deal with that kind of patient makes it relatively less difficult to deal with any other patient with asthma. So I would say just the understanding of culture, respecting the individual, all the things that are often associated with unconscious bias give us a conscious bias in favor of that patient.
Dr. Martin?
I agree 100%. Absolutely. There are absolutely better outcomes for African-American patients when they're treated by an African-American doctor for all of the reasons that Dr. Lenore just laid out. And so I'm hopeful that there will be continuing increasing numbers of African-American doctors in the pipeline as we go forward.
Doctors Martin and Lenore, thanks a lot. I mean, that's information that literally can save lives and at the very least reduce a lot of the anxiety surrounding asthma. We've got a lot more about asthma on our website, aawellnessproject.org. That's aawellnessproject, that's all one word, .org. We hope this podcast has empowered you and your family to take better control of your health, specifically your asthma. Dr. Lenore, any final thoughts?
No, I'd just like to say thank you to Dr. Martin for taking the time in what's obviously a stressful situation to give us the information. And I think it was very important to have her as a partner in this discussion.
Thank you for having me. You don't know this, Dr. Lenore, but I've admired you from afar for a very long time.
Well, you and George Strait have the same issue. Thank you so much for saying that. I appreciate that.
And Dr. Lenore, finally?
No, I have nothing left to say. I think that having programs like this and having people sponsor these programs, I think is very helpful to us. I think this is one of the things that we've struggled with through the years is finding effective methods of communication to large numbers of African Americans, and this is certainly a way in which we can correct that particular dynamic.